This is your fortnightly instalment where I interview a trailblazing physiotherapist that has shaped the profession we are today. In celebrating their journey, knowledge and insights, you gain the opportunity to plan and guide your own professional journey. My name is Doug Carey and welcome to Physio+10. Welcome new and previous listeners of Physio+10. Thanks for joining us again. Our special guest today on this podcast is Dr. Linda Khong. Welcome, Linda.
Thank you. Thank you, Doug. Thank you for the invite to share my experience of how I've traveled as a physiotherapist.
Yeah, so to get us started, could you give us a little bit of background about where you grew up and what your early schooling involved?
I originally am from Singapore. My family is still in Singapore, so I did all my schooling in Singapore, including I have a business degree from the National University of Singapore here, basically physiotherapy is like a second part of my life, my second career. So I've still got family here, and I still come back. Like now, I'm currently in Singapore celebrating the Lunar New Year, having lots of fun, lots of food, family and friends. Yeah.
Love the shirt. Show us the shirt again.
Yeah, you like the
there
Chinese.
You go. Now, let's just unpack that a bit more. You said that you did your business degree first. So the first question that comes to my mind was, why didn't you stay in the business sphere?
I did the business degree in Singapore because at that time that was the only university in Singapore. That was the only school of business. And I was very driven. I was typical, you call that Asian Chinese, here we go. We're going to earn the money, earn the pot of money, very driven. And I was on the road. I was on the road, And then what happened was I did my first trip, flew out of Singapore with a bunch, 3 girls to Nepal. And then you see different things. You see, wow, the people in Nepal, the kids, everyone, they were poor as, but they were just so cheerful and happy. And then you think, is there another life to just earning that pot of gold? And so I thought, and I came out, it was the financial crisis in Asia. And then I thought, if I'm doing business, it's tricky as you get older, you become more expensive. And the younger people can take over you. So what else is there to do? So, but then I've got to earn my keep, right? So I continued working in business. I work in management, in the fast food, Burger King or Hungry Jack's in Australia, and McDonald's, and oil and gas, sales, deep sea underwater diving equipment, all the lot, including the final one, which is outbound Singapore as an instructor.
Right.
Yes.
Where do we start with the questions on that sort of follow-up? Hey, look, did you earn your pot of gold, and how long were you in business after your epiphany in Nepal?
The epiphany was in my final year in the business degree, and I could have got, I guess, banking jobs. I was recommended, and I decided that wasn't what I wanted to do. So I didn't end up earning my pot of gold, but I had fun. I went diving and did everything I wanted. And then Outbound was the turning point for me, because other than Epiphany in Nepal, Outbound was the next one. It was experiential learning, and I worked there for 2 years. It was full-time. We lived on an island, and that was when the first batch of us, we were instructors. So many of us, you are brought experiential learning. You were taught, okay, resilience, get out of your comfort zone. And that was what I thought, okay, I'm going to get out of my comfort zone and do healthcare. That was what I wanted to do at 18, but I couldn't. I had to go for business school. You just go with what the family wants you to do. I hope that you do. And then as you get older, you think this is not I enjoy it, but this is not what I'm hoping to do. So I looked around after Outward Bound. You're going to get out of your comfort zone, do what you want to do. And I managed to get a military scholarship from Singapore to study
And
physio.
this was to study physio. Okay. Yeah.
Yes, study physio. So they gave me three opportunities to go up. I had three choices to go with King's College, Curtin, or Cumberland in Sydney, and I chose Sydney.
Yeah. Were there any friends or family members in the health industry that might have given you some flavour of what you were heading towards, or was it just a pure personal decision and realisation?
It was a personal one. I think it comes from, as an outward bound instructor, you are one end of the spectrum. So I decided I want to do the other end. And so, like the typical, I wasn't like an A-level grad by then. So I just called up the hospital, the local hospital, and just say, can I come in and see what all of you do? And at that time, it's pretty easy. You have no paperwork to fill up and everything. Those were like 1990s. So you just walk in and they just shake hand, hello, what do you do? And just sit and observe what they do. I think I called up a few. I ended up with just physio, and I thought this is not bad. I think I can do that. But of course, what you saw was just the outpatient,
Yes.
right? Physio is more than that. So yeah, but I had the military scholarship. Obviously, it was a musculoskeletal area that I ended up in the first place.
Yeah, right. So then, like, you relocated to Australia. How was that move to come away, I should say get away, but to come away from family and social networks and I guess your core group of friends, like to move to Australia to study?
After Sydney, I actually had to go back to Singapore to work in the military. So it was very sports and military physiotherapy. Covered the netball girls in Singapore, covered the military. I was doing a lot of military, the commandos and everything. So I moved to Perth mainly because I married a Scottish who became Australian. So then the decision was to move to Perth. So I just ended up going to Perth. It was supposed to be a trial for 3 years. It turned out to be 20 over years now. Yeah.
What I was wanting to get a bit of an idea about was when you left Singapore, because I'm guessing you born, schooling, business college, everything was in Singapore, your family was in Singapore, your friends were in Singapore. How did you find it moving to Australia for the undergraduate degree when you went to Cumberland?
Oh, are you saying, let me clarify, wanting to find out what the difference, how does it feel like to relocate to another country? Is that what it
Yeah,
is?
yeah, because you came to another country, another culture, no friends, no family, and studying a reasonably hard course. How did you find that whole transition
Oh, you mean like going to Sydney to study or coming to Perth to relocate to work? Which one is it?
to Sydney when you first came to Australia?
Oh, yeah. This is asking what it feels like to study in another country. I went to the train station and I said I wanted to buy a ticket. And the person spoke, and I was like, I thought Australia speaks English, but how come I can't understand this person? It was the Australian twang that I couldn't understand. And they said this AWO. I was like, what does AWO stand for?
Well, I laugh at that, but when I came back from spending a couple of years in Canada and I arrived into the Sydney airport,
Uh,
and we had to get the bus from domestic to international to domestic to fly them to Perth.
yeah.
I literally stood on the steps of that bus and just listened to the lady bus conductor ask me where I was going, and I just thought, my gosh, Australians do have quite a weird accent.
I couldn't understand what was on the TV because the English was so different. It was Australian English, but you adapt.
Well, you married a
And
Scottish man, so you must have adapted pretty well. It's still happening.
yeah, and then the other interesting thing was the cultural thing where you go to the thing and they say it's what's your, and that now it's better, but last time they used to say, what's your first name? I said, I'll say my name, Kong. And they say, no, 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 no. What's your first name? I say, Kong. Because in Mandarin, in Chinese, your first name is the family name. So then it comes all the complications. Then I realized they wanted to know Linda. So that was the first shock. It's like my name, in Chinese, you introduce yourself, your family name. Now it's better because they say, what's your family name? What's your first, your given name?
I guess.
So that's clear. But in 1990s, it was so different.
Yeah, there you go. All right, let's jump to Perth. You've come to Perth. You've married a lovely Scottish lad. And yeah, what are you doing in Perth at this point in time?
When I first came to, let's start with when I first came to Perth, I didn't know anyone. I didn't even know where I lived. I lived in Cottesloe, but I thought I was in the country because it was so peaceful. Because I call IKEA, I said, do you do delivery? They say, we go to Cottesloe. And we do delivery Metropolitan. They say, where are you? I said, I looked up, there's no cars, there's no people. I said, I'm in the country. But Cottesloe, of course, they're not Metropolitan, right? So that's stuck in my mind, how I didn't know anyone. I couldn't even get a library card because I had no referee. Yeah.
Right.
Yeah. So that was how it started. But I started at Royal Perth Hospital, in a general ward. I guess it's the same. Moving to Perth is like someone in Perth, I will say, moving to another state, because you leave all your, connections back there. People in another state, New South Wales, might not know what Royal Perth Hospital is. It's basically quite akin to moving to another state, I feel. So in a hospital, doing the general like a graduate, going through the rotations, because in the military, I was doing a lot of musculoskeletal, so not a lot of respiratory. So that was my next phase. From the military, I did the master's in manual therapy because I wanted to do the differential diagnosis, the clinical reasoning, which I felt was the gap. So then I started applying to work in Royal Perth. Then obviously it was doing respiratory, the whole load oncology, going through the rotation basically, which is what I felt I needed to do to integrate all my learning after graduation.
Sorry, so you did the Masters in Musculoskeletal after the military, but before you started working at Royal Perth?
Yeah, because after the military, I always felt that, in undergrad, you learn the stuff, but you come out, you realize there's a lot more you don't know. And I also realized I haven't had the opportunity to integrate all my clinical reasoning, differential diagnosis. And I felt I needed to do this master's, and also as an excuse, a break from work. So I did it in Curtin. It was lovely with Peter Sullivan and Bob Elvey at that time. I had a great time with the masters, my peers. And then the funny thing was, there was a lymphedema course on, and I went to do the whole works from level 1 to level 4 in one go in a month. And then I started working. Then I thought, oh, well, it's time to get to work. I better work. So I applied and I got into Royal Perth Hospital.
Right. So this is where the little seed of lymphedema started. What was the course that you did, and why did you choose that one? Apart from having a holiday.
It was a holiday. I mean, it was a holiday from physical work, but challenging in the terms of you're learning new areas in the masters and also in lymphedema. It was because in Singapore, my good friend was doing lymphedema, and she said, "Hey, Linda, the course is running in Perth, level 1, level 2." So I said, "Oh, I don't really know anyone. I think it's a good time to get to know people." But Voda is actually a school in lymphedema, but it was mainly very massage therapist. So it was the time of Google, before the Google Maps. So I got lost going to the Perth Hills and coming back. And then I met up with a group of massage therapists, and I learned that was how it started with lymphedema. And I never really regret doing VODA, even though people feel, you know, it's not exactly physio run, but I think from VODA, I learned level 1 to level 4. They were very strict about it. You learn what is lymphedema. The most important thing I came away was the hands-on. Because with massage therapists, hands-on is so important. I think, and with VODA, you have to what do you call it, recertify every 2 years. So every 2 years, you meet up with your colleagues from be it all over the world, and then you have to recertify your hands-on skills again, and your bandaging and everything else. So I think it's one of the lymphedema causes that is always shaping, always ongoing, and it's always very good because I went to other lymphedema schools. They were good, but body is where I got my hands-on skills. I even went to Austria and Germany to do that.
So I guess if there are young physios listening to this and they're going to think lymphedema, I might know how to spell it, but I'm not quite sure what it involves. Where would you, because it's not really undergraduate stuff either, where would you encourage them to go to, maybe if they were interested in this type of patient, to sort of find out a bit more, or perhaps get some, a taster or some sort of experience in this area?
Well, people have asked me time and time again in the last 20 over years. I trained in 2003. I always say, just take the first course that's available to you, because if this is a career you want to go, it's not going to be your first, it's not going to be your last one. Just get onto it, because it's like a train. Wait for the best one, you never get onto it. Just go for it. And then you get your taster, isn't it? Like I learned in 2003, I never used it in 2006.
Yeah. I'm starting to get an impression here, Linda. Business, Nepal, outward bound, physio, masters, lymphedema. I'm getting this impression that you jump on a lot of fast moving trains. All right. So you did the course, you had your month of working holiday, you went back to Royal Perth. At some point in time, you've decided to move away from the rotations in Royal Perth. Was the next decision that you made a conscious decision, or did you kind of fall into it, or did you jump on it?
I think at Royal Perth, I enjoyed all the rotation. I did what I wanted to do. So the next move was what's next, I guess. And I believe in life, you can plan, but sometimes the opportunity doesn't present. And so I decided to just quit without a job. And I recall then my colleagues were pretty worried for me. They were like, where are you going next? Don't know. I'm just quitting.
So what you're saying is that you felt like you'd learned as much as you could learn, and you therefore wanted to create some space for the next opportunity, even though it wasn't there?
Yeah, I decided that I've learned what I wanted, but I missed out one part, which is the spinal. And I wasn't prepared to go in to be a senior, because usually after doing a free rotation for 2 to 3 years, the next thing is you go for a senior position in physio in a hospital, even including MPT and things. But I felt this is not really, I didn't feel my calling. So I decided I'm going to just quit and just see what happens, and see what opportunity presents. And it presented.
So we have a drum roll now.
Yeah.
All right. And what presented?
And my friend and colleague, Christine Smith, said, Linda, Cancer Council has a job, lymphedema. Are you interested? I says, wow, I haven't trained since 3 years ago. Is it still relevant? Don't worry about it, just go. So I went for the interview, and I had such a bunch of great mentors in the Cancer Council clinic, who have been there for years. And then, they got me started. So I think for young physios who want to you do the course, and then probably you want to do so-called internship at some clinic with some nice mentors who are willing to coach you, get you started on where the suppliers are. That's a great start. If you don't have, it's also good to start, but you end up with great mentors. It's a great learning experience.
Yeah. So for those that are not familiar with lymphedema, can you sort of give us a bit of an outline about the common type of presentation that you would see and how physiotherapy might assist that type of person?
Okay, maybe I'll just start with explaining what lymphedema is. Lymphedema is swelling. So usually it presents two types. We call it the primary, very generically, primary or secondary. So primary are those people who are congenital. So they are born with less functioning lymphatics or okay number, but defective or something like that. So it can be from birth, it can present itself at teenage, present 20 something, present at 30 something, can present after pregnancy, present at some stage, and it's primary. Okay, you dig through the whole history, you can't see very much on how it might trigger. The other group, which is what a lot of people know as, is secondary to something, secondary to accident, hip replacement, knee replacement, secondary to cancer, to radiation, and they present secondary to something. So, but what's lymphedema? Lymphedema is where your lymphatics are not, let's say, carrying its weight, and you end up with swelling and it's clearing. Lymphatics have a role in your immune system. It's clearing the waste in your body towards the lymph nodes. So the lymph nodes will filter and then clear it out of your system. So if you got lymphedema, mainly people will see swelling in any part of your body. It can happen in any part of your body. But what it is, the secondary effects, you are more prone to risk of infection because the waste is not being cleared out of your body as optimally as other people, be it in one limb, be it in your head and neck or somewhere else. And also because of swelling, let's say if it's your foot, if you have ankle sprain before with large swelling, how does it feel like to walk on it? It's wobbly, it's painful, and then you have problem wearing your shoes, isn't it? So imagine you are an older person with swollen leg, wearing your shoes, walking. You can't bend your ankle. And then over time, what happens? It gets so tight, it aches, it's painful. And then you have the risk of ulcers, and then you have the risk of infection, and all the skin can, all these issues that come along. So that's, in a very simple nutshell, lymphedema and some of the effects and risks that presents with lymphedema.
Yeah, well, thanks for the explanation. And I mean, it does, even in private practice where you supposedly, I mean, I'm a country practice, and so you see everything and anything, I guess. And sometimes you look at people's legs and you think, yeah, that's not going to help you with your balance, or that's not going to help with that skin tissue healing. So it's kind of applicable. And I guess the whole thing, the population is aging, and we're probably going to see more and more of this.
Yeah.
So it's something that's, as physios, as primary contact practitioners, again, we need to have an awareness of, and probably have some rudimentary understanding of how we manage it as well.
Yeah, I think there were 3 risk factors. Lymphedema is obesity, older age, and disability. So, and like I said, it's right. Physios are the primary, the first contact. And I see evolving in the last 20 years. And it's getting more challenging in the private. I have to say, sometimes I would say physiotherapists need to be a bit more, what do I call it, pick it up, because sometimes I have to give credit. Sometimes the doctors pick it up before the physios. Or, let's say if you have a patient with a knee replacement and the swelling is there, you've been working on it for 3 months, it's not going to get anywhere. The range is there. The range, you're struggling to get that range. The wound is not healing up. Something else is happening. Okay. And then that's where it's time to refer to someone else to take a look at the swelling. Because we know if you see the patient, I remember in those days, If you can't get a patient towards your goal of treatment within 6 sessions, you need to have a think what else is happening. So if your patient has it for swelling, after post-op 3 months, still swelling, can't get the range, something else is happening. You need some help from someone else. It's time to check around.
Yeah, hey, that's a golden rule, isn't it? Like,
yes,
the old line in the sand, if you're not making progress after 6 treatments, or even first call is after 3, but after 6, you seriously have to ask yourself, are you helping this person or hindering that person in their advancement?
yeah. So I'm very impressed with some of the doctors, even podiatrists will do the referral. And unfortunately, not as much as physios
Yeah.
to my area. So, and I'm not talking about junior physios, senior physios. Physios, you see the names in the papers. And it's not the first time. I've seen other patients of theirs, and still they haven't done that. So I was a bit disappointed. I was about to go, thinking about going knocking on the door to ask them, hey, what's happening? I'm not trying to drum up more business, but it's patient care, integrated patient care.
Yeah. All right. Well, we might talk about that some other time, because I think there's obviously opportunity for an educational process. Look, I'm going to ask you this question because we've got a lot of physios, younger physios that listen to this podcast. And with your different backgrounds, you got your business, which I actually didn't know about, but I was thinking about your musk, your gerontology, because that's where you did your PhD. You obviously your lymphedema, and you're largely known for that latter sort of area. Is that a deliberate choice that you made for a business marketing reason, now that I know about your business? Or is that just something you found was a passion and a calling, and you just really love doing the lymphedema?
I think it's both. It's both. Um, um, I think at the start, I knew, I think everything, at the start of my career, I knew you always want to give yourself options. I enjoyed the hospital work. I still work in a hospital. It's a Charles Gardner Hospital, Royal Perth on the weekend. I still enjoy them. But I always said, you should give yourself some options to go private if you want to. And I was looking, the private you have, if you want to create a niche, it's vestibular, TMJ, health and safety, women's health, lymphedema, other than sports and physiotherapy that everybody knew. So I ruled out one after another, and also the opportunity presented, and I thought, okay, I'll do lymphedema. But at the moment, every patient they're not a textbook patient. They come with everything else. So I thought I wanted to do and get a general skill set first so that I can identify it. Um, and everything else is complementary. All the skills that are, because with my PhD, I learned education. Part of my PhD was learning about peer education. So my supervisor was in education, Professor Richard Burleck. So I learned about education. I learned about how to educate people from patients' perspective. I learned about what older people want, how you see people, education on how you do adult learning. So it's all complementary. Yes, it was deliberate, but not exactly deliberate, but it's more like following my passion, and along the way, grit to get there after 20 over years.
Yeah. Well, you've got quite a diverse range of skills, I guess, when you talk about your work, your research, you're teaching in private, you're treating in private, treating in hospitals, and also some educational sort of components to it there. How important is it for you to have this sort of, I wouldn't say balance, because I'm not sure if it is balance for you, but how would you say important it is for you to have these different avenues of outlets for your creativity?
I think at the end of the day, it's prioritization. At this moment of time, what's the priority? What do you want to do? And then you see yourself like I think like most people, what do you want to see yourself in 5 years' time, and what to do and how you juggle the act. So when I finished, I managed to get some funding, or well, the opportunity for funding came along. I applied for it with the help of Notre Dame Institute of Health Research drew up the paid proposal, got the funding, did the research in lymphedema, and then after that, got on to the was doing my private. I think everything in life is just prioritization. Is it what do you feel like you want to do? You can plan for it, but you can't exactly make it happen, isn't it? Until just go with the flow.
Well, I'm getting two messages here. I'm getting a very strong message that you are very goal orientated, driven, and actually make some quite conscious decisions about the directions you go. But at the same time, you don't kind of force the issue. It's kind of like, well, if it happens, it happens. If it doesn't, and that's what I want to do, that's okay. I'll still do it. And that seems like a pretty rare combination. Is that a Singaporean philosophy? Because I don't think it's Australian.
It's a mix of Singapore and Australian. It's like go with the flow, but in the Singapore side, goal driven, you have to go. But there are other things that come along the way. You just have to inbuild some flexibility and optimize what you have and go positive. But with the resilience that I learned from Outward Bound, get out of your comfort zone. You think too much, you never get there. Just, I'm not sure if I was supposed to say that on a podcast. Just close your eyes and go for it. It's like the
Depends if you're
flying
standing
fox.
still or jumping.
Yeah, the flying fox or jumping into the waters. It's like you stand there, you will never get going. If you go somewhere, isn't it?
Yeah. Hey, look, what would you say is the hardest lesson you've learned so far as a physiotherapist?
I think for anyone as a physio who's probably going to business, get yourself a very good lawyer. Make sure you learn something about business and get yourself a good lawyer. When you make contracts, when you make business contracts and you make business decisions, probably not as a physio, but as a physio going to private or going to any kind of contract, because this is what's happening in my life at the moment.
I was going to ask you, is
I'm
there a
not
particular reason?
I'm not at the I am not in a state to divulge what's happening, but I would say that we learn in physio school clinical skills, but like all of us who go into private or going somewhere else, fortunately, I got my business background, so I can look at the P&L sheet. I can do bookkeeping. I can do a lot of things, marketing. It gives me a good background, but the legal aspects, I was a bit naive. So, so I would say that the hardest lesson I'm learning now is get yourself a good lawyer.
Yeah.
Before you do anything, any contracts or anything like that.
Okay, well, thank you. I won't, as you said, it's, these things are obviously temporal and you've got to, stay quiet on some issues at the time. Definitely been in that situation too.
Yeah.
So next question is, for $200 or less, what's your best book or tool or app or other investment that you've made? Because it's only going to get you about 20 minutes with a lawyer, but what have you used to further your clinical development?
The best one is going to Duck. I'm not selling for you. It's going to what Duck Carey's education courses are, and trust that Duck would have sorted out all those people who are going to be your instructors, and trust that they would give you good value. I've been with Mark Oliver TMJ because now I'm doing more focusing on head and neck lymphedema in the public, and also it's growing in the private. It's not just lymphedema, but it's actually the head and neck. Is I did Mark Oliver at the beginning, 2003. He didn't realize it. And then I did it in 2000. I did it twice in 2021, I think, when the pandemic opened up. And I did it again. And every time I'm learning. So I would say the best one is just trust that Duck would have sussed out all your instructors and and identify your gap, and then hope that Doug has got some instructor there. Because the next one I'm looking at is fascia.
Yes. Yeah,
Because
it's
fascia for the head and neck is big, the platysma is big.
and it's
Yeah.
it's interesting as you get, we'll both say more mature in our clinical approach, and you start to realize, I guess, the holes and the finessing that you need to have in your clinical practice, because I mean, we all have to start somewhere, and so that's the good thing about being a new grad. But now we've got so many opportunities that I think you have to look at what sort of clinical practice you're doing, and then try and sort out the chaff from the wheat as to what courses you want to do to further your understanding in that area. And that's, and I love the fact you've been to Mark's class or course 2 or 3 times, because it amazes me that people come to a course and think they'll learn it all in that first time. And they don't want to come back to do it again because they think they're not going to learn anything. And I mean, for me, like, say I teach the wet lab anatomy at least 2, maybe 3 times a year for like 20 years. And I'm still learning stuff, and I'm teaching it as I go, because it's just being in the situation of having to think about it and apply it. And, you're always learning. So yeah, like, don't think you're doing the same course is the wrong way. If you've got a passion about something and you've got an instructor or a mentor you think's good, go and learn from them, because you certainly will.
Yeah, I think I mean, the more you learn, the more you don't know. The more you learn, the more you realize you don't know. And I found that over the years, I don't just have to learn from physio. I learned from a chiropractor. I learned from massage therapist who's border. I learned from even the speech. Like I saw a patient in a hospital and he had a neck fusion and he has a coarse voice. He had no nerve involvement. I was like, what the heck is happening? The speech, call for the speech. And she came and then it's the vagus nerve. I was like, oh my gosh, you learn all this thing, but you forget to apply. So you learn, that's why I still love working in a hospital. And that was on the weekend. You get paid and you still get learning.
Oh, there you go. All
So
right.
less
So coming back to some structured questions, I love that deviations that you sort of seem to have so many of them. What's your most out on the limb decision you've made clinically in regards to your career, and what was the outcome of that decision?
the out of the limb was going to do the lymphedema course because I wanted to see what the Perth Hills was like and to get to know people, Aussie people. And I got to know them. They're still my friends. And who knew that when I did it, it was going to be my niche area 20 years down the road,
Yeah.
you know?
And you didn't mention that you also actually went to the country, because you'd been living in Cottesloe, which wasn't the country.
But the other thing is, when in Sydney, I got posted to the country, Orange. It was beautiful. So I thought, hey, if I didn't have this business, I would actually be a locum to go to the country. Because, like you say, in the country, you need to be varied and integrated. And I wouldn't mind going to do locum. Maybe in the next
Well,
phase when I retire.
well, next time you want to come and have a sea change, Esperance has always got a place for you, Linda, I'm sure.
I'll think about it. Of course, I love Esperance.
Yeah.
The beach, it was beautiful.
And the kangaroos, who doesn't?
Yeah, that's right.
Professionally, what 3 things sort of stand out for you so far in your career?
It was that everything you learn is never going to be wasted, be it life skills or professional skills. Everything is complementary. Everything complementary towards the unique you. And I did it more because I identified gaps in my skill set that I needed to do. And then I'll say the other thing is follow your passion. It may not be marketable, it may not be fashionable, but if this is your niche, follow it with grit and resilience, you get there, and the patients can see your interest in them. It's just not an in and out 9 to 5 job. And the patients engage with you. Because if it's in your passion, it will show through in the way you deal with them. And if patients are engaged, then the business will come, not the other way around.
Yeah, and that just runs right top and tail with I did a podcast with Randall Cooper just a week ago, and
Yes.
he looked at it from the other way. So said, don't drive yourself into a dead end. So you're basically saying, if you've got a passion, follow it, and you will draw those types of people towards you because of that passion. And Randall was saying to young physios, be careful, you just don't do a job for the sake of doing a job, because you're going to drive yourself into a dead end, and that will also reflect in your patients and, consequently, I guess, in your career development as well.
Yes,
Yeah, so
that's right.
interesting.
I mean, it's a long time to be working in a job that you don't really like, is it? Or doing the area you don't really like.
Yeah,
Just just get out of your comfort zone and just go for it. When I started here in this area in a private, there were only just a handful of it. It wasn't fashionable at that time. I remember my first day in my clinic, I opened up one patient. Everybody was worried for me. So I had to do what university clinical tutoring to support the income, at Curtin and Notre Dame to get it going, because at that time there's no internet. So you had to go by word of mouth and all that stuff. It was very slow, but it's good. It gives you the opportunity at the time to develop other things, to grow your business
yeah.
and your passion.
And fashionably, we call that a side hustle nowadays. It's got a little terminology for it.
Yes, side hustle. Correct,
Yeah.
correct. Yes.
So if you could step back to yourself, this is your younger self, and we'll just miss the business bit but come into the physio bit. If you could
Mm-hmm.
step back to your younger physio, are there sort of any bits of advice you'd pass on to yourself that you might think might help your development, knowing what you know now?
Mm, I think if a young physio, try everything that you're interested in, and then but also give yourself a niche and options, and if you can, mentors. Identify where you want to go. It might be vague. Get yourself some mentors and go for it. I don't think we can really, plan that well, but just have a big goal and work towards it. Get out of your comfort zone and go for it.
In synopsis, get out of your comfort zone, have a goal, but stay flexible.
Yes, exactly. Well done.
I'm learning, Linda. I'm getting there.
Yeah.
Looking forward, like, you've got an overview of the physio profession. You've seen it from lots of different angles. And also, we haven't mentioned the professional associations you've been involved with.
Mm.
But looking forward, where would you like to see our profession of physiotherapy going, or where do you see it going?
I think this is only from my perspective. I think a lot of junior physios come in the professions as someone coming from Singapore. Also, I think from Singapore perspective, physios, that's what I see. Generally, people tend to want to come into acute care hospital. It's like I get a feeling people just want to work in a hospital. There are lots of opportunities in the community, um, chronic care. They may not be as glamorous, but they are just as rewarding, just as fulfilling, and just look out. There's more to the world than the hospitals.
Well,
And the
you kind of
hospital,
have to. I mean, sorry
yeah.
to interrupt. You keep going. You keep going.
No, 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 no. You go.
Oh, I was just going to say, you kind of have to. I mean, I guess this is a bit of a thing at the moment where probably 50, 55, 60% of physios are now graduating and they're not going into Australian hospitals because they don't have the places available. So physios are literally being seismically shifted either onto private practice or into vocational rehab or community care. So they're having to consider that. Is that what's happening in Singapore as well?
As far as I know, there's not a lot of physios in lymphedema in the private sector in Singapore.
Yeah.
The main
So
person that's known in it is a massage therapist.
yeah. And
Um,
do you like this might be a little bit no, I won't say. Would you say that in general a physiotherapist is better positioned or a massage therapist better positioned to treat a lymphedema patient with their background and their science and their path and DAG and anatomy skills? Or it doesn't really matter?
um, I'm treading on very thin ice when I answer
Okay,
that.
well, that's fine. We'll leave it. I don't want to be controversial, but I just had wondered because it's not part of our
Maybe
undergraduate.
that's a good question. I just want to say that I don't want to compare, but I think the physio has value add because we know the um um I've got a very good massage therapist. She's wonderful. But I think that physio has got value add on top of lymphedema because you know, once you get the swelling down, let's say, for example, a certain person with a knee replacement or something like that, which I had a recent one, he was a Chinese traditional medicine doctor, a chiropractor, knee replacement, got the swelling down, had the palm, got the palm going, got the swelling down. I look at the gait, I look at his range, I look at his strength of his lower limb, I look at his gait, I advise that he should see a podiatrist. I, told him what he can do in terms of rehab. It's the value add that we can add on and in a holistic point of view. And also, he added on his acupuncture and things like that. So I think it's the value add that we can add on from a physio perspective compared to other professions. But of course, I would say for physiotherapy to advance, we need to collaborate with a lot of other professions, exercise physiologists, because so far my private practice, I've always been predominantly started in an exercise physiologist clinic. And it's also very good because they have their own skill set and you can move to them and learning from podiatrists, learning from speech therapists, learning from everyone, chiropractor. This is where I see physio needs to go because the skill set may not be just within the physios itself. Like we learned it from osteopaths, so many people.
Yeah. It's that willingness to learn, isn't it?
Yeah.
Yeah.
It's just to advance the patient care.
Yeah. Yeah. So where do you see yourself, Dr. Linda Khong, heading in the next few years? What are your sort of goals around your flexibilities and your jumping off bridges with eyes closed approach going?
I think at the moment I think people have told me that I'm at a crossroads. Do I still want to stay as a sole practitioner, or do I want to expand and get more people on board? I don't know. We'll come to it when we cross that.
Well, stay tuned. We'll cut to a commercial and we'll find out in 5 years' time what you decided to do. Linda, thank you so much. Have a lovely time up in Singapore and celebrating the Chinese New Year.
Thank
We
you.
really appreciate you joining us and sharing what has been a way more complicated and detailed and exciting career than I was aware of. And I'm so glad you shared some time with us and explained about your journey and your thoughts. It's been a real pleasure. Thank you so much, Linda.
You're welcome. Thank you for your time and for letting me have this opportunity to share my experience, check it as it may be.
It's been beautiful. Thanks, Linda.
Thank you.
Thanks so much for listening to this episode of Physio+10, in which I trust you gained some valuable insights. It'd be awesome if you could leave your 2 cents worth as a review or rating of this podcast, and I look forward to sharing the story of another trailblazing physiotherapist with you in 2 weeks' time. Stay safe. Bye for now.